Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
You have heard, of course, Leslie Curtis, who is the director of the business development of Regents Park of Boca Raton. You've heard her on our show many, many years. And she's always a caring, lovely woman who talks about this great place, Regents Park. But I am ANITA FINLEY, and I have always been the host of the show. And I have covered a lot of things, and I've always known what a lovely place it is. But until you experience it yourself with someone whom you love, you really don't know or don't appreciate what an organization has to do.
Yeah, it's truly different being on the other side of the equation. As a caregiver, family member, you appreciate, I guess, everything that goes into making a building like that run, and it's amazing. It's a lot of different variables that you just would never think about.
A lot of personnel.
Yeah, a lot of personnel.
And a lot of responsibilities, and it's night and day. 24 hours.
24/7. Yeah.
And so I always, in my brain, the rehab center was someone had a hip replacement or a knee replacement, and they went in and they had therapy, and that was it. And then they went home.
Right.
But for those of you who have listened to the show, you probably know that my darling husband, Bill, passed away this January the 25th. And the last place that he died in the Boca Raton Regional Hospital, but the place he spent a lot of weeks was at Regents Park. And Leslie went above and beyond the call of duty and friendship. And I'm very, very appreciative of it because it's a very lonely world when you're a caregiver.
It really is. And it's hard to understand that until you're actually in that role. I've said it a gazillion times, but people don't hear it until you're faced with it. That, when a patient comes in and it's not for a routine surgery, it's from multiple medical conditions, stroke, someone that's 101 with pneumonia, things like that, where you are dealing with families in crisis. And that's, the caregiver is in crisis. And, everybody deals with these things in different ways, as you know. It might be to forge forward and try to fix everything and or become totally debilitated. It's all different aspects of personalities that we deal with. But our job is to not just take care of the patient, it's to take care of the caregiver.
That's a very good point. We've never talked about that before. But you did take very good care of me, even to the point where they brought in a bed because they knew I was going to stay there. I was prepared. I bought a sleeping bag, actually.
Yeah, she did.
Which wouldn't have been very comfortable, I know. But you brought in a bed, and and people brought in, some of my family members brought in blankets, and it was like I was camping there, actually.
Yeah.
Because I had to camp there because I really wanted to stay as an advocate for my husband. And the one fallacy, and we discussed this, is a lot of people don't realize how important advocates are.
Oh, no, they don't. As a nurse and, we have social workers, and we advocate, for our patients and for our families. Those poor people that are alone, and the kids live up north or wherever, it's very difficult for the patient. Whether they're confused or totally with it, they're lonely, they're scared, so you have to give them special consideration. You really do.
Do you get a lot of phone calls from the families who are up north to keep you up on things? Is that how you communicate?
Yeah, they'll communicate with the social workers, but yeah, we do. It's always nice when they can come down. That's not always possible, and you'll see the families where they have teenage kids, and they have a job, and, they're kind of tag teaming each other to come down and spend time with mom or dad, but it's very hard. And in this area, we have a lot of elders that the kids live elsewhere.
Right, and a lot of them don't even have family members. We're talking about Regents Park of Boca Raton. It's really a rehab center and also a skilled nursing facility. And they have, I guess there are 4 wings. I learned that.
Yes.
By going 4 wings, and it seems like there's always something going on, whether they have activities for the general population, all sorts of interesting things they announce, or if they are in a late shift at night where they have nurses who have to watch. I mean, the interesting thing for me was, those, I don't know what you call them, those tables they move around. It's not a table. It has the meds.
The medications.
The medication. And they know exactly. It's all on computer. Who gets what.
Right.
And you have to get this, you have to get that. I don't know what they did years ago. I guess that's a nice way to be able to move from room to room.
No, in the old days, you went to the med room and had to, get your patients' meds one by one. So
could be a chance for more errors.
Yeah.
This way, it's all on computer, and you get to see what they're supposed to have and what they're not having. And I guess the worst part is they come in the middle of the night, and then it's all around the clock when you're staying there as a caregiver. So it's like just get to sleep, and all of a sudden there they are. They got to get more things, and they have to do this, and they have to turn the patient. And I will say, in due respect, which was great, your wound care center, whatever you have, was amazing. I mean, they checked my husband Bill's rear end, his back, his foot. They even someone brought from one of the departments these little slippers that they put on his feet,
right?
So that, because you don't think about, at least most of us don't think about someone lying there, even if they're turned, that they could get, to get a little bit of, starts with a little redness, and before you know it more, and that's what you don't want to have. And the wound care was extraordinary. In fact, when they went to the hospital, they remarked that for someone who had been in bed, who didn't move around very much, that it's amazing there were no wounds.
Right. They do an excellent job. I mean, I will tell you that most of the time our patients come in with the wounds from being in bed, and we heal them.
And that says a lot. That's not easy to do.
No, in the old days it was, because when I worked in the hospitals or ICU, it was patients came in from the nursing home with these horrible bed sores. Those days are gone. I mean, we get them in, and there's treatment initiated the night of admission, the turning, the moving, and it wakes you up. And if you're in a semi-private room, it's going to wake up your roommate, but it's just something that has to happen.
Right, and I saw what they were doing, and they're these not bandages, but it's like skin goes over, and they have medication on it. So I think you're doing a great job with that. And then, of course, the one thing that does happen, and this is what I guess where Bill failed in a sense, was the therapy for respiratory.
Right.
Yeah. You do have a lot of people who put that mask on to be able to clear their lungs.
Right. He was getting the nebulizer treatment.
Yes, in fact, I got that at Dr. Mencia's when I had a bad bronchial cold.
Yeah.
And it does really clear it. It's amazing.
It helps you cough that stuff up. Yeah.
Yeah, it does. But but I didn't realize you had. I'm sure on the show you've brought your the head of respiratory. You've brought the head of PT. You've brought those people to be on the show, but until I really saw what they did.
Yeah.
It really puts a different flavor on. In fact, the physical therapy realized that Bill at some point wasn't able to go in all the time to the physical therapy room, and they came to his room.
Right. And
they really tried to help. And there's one particular young man who I think has a little bit of a speech problem, but what he doesn't say in speech, he does in heart. He was so sweet to my husband and just stood there and worked his arms and worked his legs, and that was really nice. I was very appreciative of him.
Yeah, they're good. Therapists are excellent.
Right, and of course you have a lot of people when you go into the therapy room, I mean, physical therapy, and you have to walk out because there's a lot of traffic. They don't want you in there, but they give what they have to have, and it's critical to have that therapy, isn't it?
Yes, it is. It really is. You have to move the joints. You have to move, regardless of what stage you're in or what's going on, you have to move, and, some people it's more difficult with if they can't really move themselves that much.
The one thing that I never knew about, I never heard of swallow tests. Mm-hmm. And apparently people in the medical field know about it.
Oh, yeah.
But I think that was one of the things, the downfall, because I don't know when your throat starts to not work so well, whether maybe as you age it happens, and then if something else happens, it gets worse.
Yeah, I mean, people with Parkinson's, it's critical to watch them. You'll talk to family members. Yeah, they cough a lot when they're eating or right after they drink. Well, they're probably silently aspirating or getting close to it. So that's always a sign that you want to keep an eye on them, because you shouldn't cough every time you eat or drink.
Well, unfortunately, Bill didn't cough every time he ate and drank before he went in for his operation.
Right.
But it seemed that after that, they wanted him to pass the swallow test. And it was like, what's a swallow test? And then they have this where they see how the muscles, they do this, simulcast. They do this, visual, they have a visual way of an x-ray or something. And if you can't pass it, they're afraid that they will aspirate, which then could produce pneumonia.
Right.
Or other kinds of deadly things. So one thing leads to another because, they try to teach them how to swallow.
Right.
Again, which is, you and I take this for granted.
Yeah.
And I wish there were some sort of technique to help them learn how to swallow. Apparently, it depends what stage of that swallowing you're in.
Right. And I mean, it all depends. My friend had a stroke years ago. And she will, if she's eating or drinking too fast, she'll start to cough. It's like, you got to slow it down, take smaller bites, So it's a matter of, and she's up and about. But, yeah, sometimes, you have to continue those compensatory things that you learned from the speech therapist.
But I think that I know a lot more about it. I don't know if... I don't think most people understand about the swallow test, and because when people would say to me, because eventually when he wasn't swallowing, then he was losing nutrition.
Right.
So that's then when they had to put in they tried it some other way first, and then they had to go to a food peg.
Right, the feeding tube,
which is even different, and then that's not perfect.
No.
So once you have that swallowing problem, so now we have to invent something, maybe that you... for swallowing. I don't know what that is, but I guess it's all part of... See, you as a nurse understood a lot of this, but I thought I understood a lot of things, but my husband was my teacher, I guess, when I learned so much about what goes on.
Right. And it's, it's very difficult because, when people are compromised medically for whatever reason, now you have to look at nutrition. You have to look at their labs much more closely to make sure that they're getting enough fluid, they're getting enough nutrition, that we're not brewing some kind of infection. Then there's the culture, and it goes on and on, which you now know.
I do.
And it's so easy when you're in that kind of a compromised state to develop pneumonia, to develop infections. Urinary tract infections are almost a dime a dozen. I've said that to you. But you don't think about it until you're dealing with it and how much they can add to decline. Because now you're on antibiotics, and now you really have to watch the renal function. I mean, it's very difficult. And it's, the care that we give at Regents Park years ago would have been done in the hospital.
That's right. That was my next question about when you said someone came in with pneumonia. Why did the hospital release that person?
They do it all the time because they don't
want to get them in and out.
Right.
And so you have to be really a semi-hospital, a mini hospital.
For a lot of patients, we do. They're on, and again, it depends on why they had pneumonia. Is it from a swallowing issue? Was it a community-acquired pneumonia? Bronchitis that ended up, how. So it really depends, number one, on why they had pneumonia. But at the very least, they're going to be getting antibiotics. We want them up and moving. They're going to get respiratory, nursing, the therapies,
Well, I just want everyone to know you're listening to Leslie Curtis, who's the Director of Business Development at the Regents Park of Boca Raton. If you really are having any situation where you need to go somewhere that's going to give you a lot of care, a lot of love, a lot of good, smart rehab, please do call. And the phone number there is 561-483-9282, 483-9282. And they have a website, which is regentsparkboca.com. And I said this to Leslie while I was there. Nothing's perfect. But of all the places that you can go,
right,
it's closest to perfect is because you're dealing with people who are in the nursing business, whether they're a CNA or whether they're in food preparation,
right,
whether they're in respiratory, whatever it is. And most of the people I met there had a great heart, and they were kind, and they really tried to care about a patient.
And we're in the business of people. It's not, hotels, hospitality, and it's a whole. I mean, we certainly try, but you're dealing with, again, sick patients in pain, families in crisis. There's never enough hours in the day, never.
I respect Leslie for that because she called me when she, of course, was off. And I know we're friends, but it was so nice to know she was always caring, watching, she's making sure that I had my food, which, by the way, the food's very good. I have to tell you, I had more oatmeal, and I'm supposed to have oatmeal, but I usually don't fix it. My mother was very happy because she always wanted me to have oatmeal. So I had my oatmeal in the morning and my egg. And then, the food was fine. I mean, it's not like a gourmet restaurant, but on the other hand, your soups are great. And I love the soup, and I'm a big soup person. So that was good. So I actually lived there like it was a hotel for me.
Right, you did.
You really did because, I had my husband there, and I didn't want to leave him. And of course, there are always extraordinary CNAs. Some people who just go above and beyond what they should. They're so kind and so nice.
Yeah.
And then you have people who are just, in general, they're doing their job, and that happens everywhere.
Right.
But I found a lot of the people, I was already planning on taking Bill home.
Right.
I knew, okay, well, we're going to get as much therapy as we can, then I'm going to take him home, and then now I know what to look for. And I'll tell you the one thing that I want to talk about is the Hoya lift.
Oh, yeah.
I mean, I guess I heard of it, but I never knew what that was.
Yeah.
And that is an amazing apparatus.
Yeah. Back in the day when I was doing bedside nursing, they didn't have things like that.
Right. What did you do? You had to break your back and try to take people from the bed to
the chair. It's a lifesaver for the staff, certainly, and for the patient. You have to tug on them and do all those things. You can safely get them from the bed to the chair. With as little trauma as possible.
I used to tell Bill he was in a parachute.
Yeah.
Because, they'd lift it up, and it is an amazing apparatus. And I thought, well, if I take him home, I might have to buy one of those or rent one. I mean, I had it all planned. But unfortunately, it just didn't work out, and we couldn't take him home. But Bill at least he had a safe exit.
Yes.
And I know a lot of people don't have safe exits. A lot of people are at home. and they think they want to die at home, or they want to, and maybe under some circumstances it's okay. But for the kind of care that Bill was getting, he couldn't have been at home. I couldn't have had all those doctors and all the nurses and everybody taking care of him.
Right.
And so that's really what you have to look at. Of course, I didn't even go very often. Once I think I went into your skilled nursing, and boy, they have a lot of people there.
Yeah.
Because it's different.
Mm-hmm. Our long-term residents.
Yes. Yeah. But, and the funny thing, I was next to, the next room had a man who, I don't know what his situation was, but he had a lot of family coming in from all over, and they were making a lot of noise. They were having a good time because that's what it was about, to help their loved one get better.
Right. And
they did, and they brought out some food, and they did all sorts of things. I was listening to them. So it is it's like a little city.
Yes, it is.
A medical city.
Yeah, it is. Because we, the swallowing test, a truck comes in and we don't have to send the patient to the hospital for those. We can do our own X-rays and Doppler studies and EKGs and all those things that need to be done, and you want quick results, labs. It's all done there.
Yeah, you did all that. I know. I was there. I watched it.
So, that way we can take better care of the patient.
Well, let's just talk about what the ideal situation is for a person. Someone who is going to have either something, shoulder repair, a knee repair, a hip repair, a foot repair, could be anything. The perfect thing is that they come there 2 weeks, they go home.
Right.
Because they have their physical therapy and it's done.
Yeah, you don't want anybody to stay longer than they have to. But 2 weeks, again, depending on age and ability, 2 to 3 weeks, sometimes 5 days, it depends on the patient. But absolutely, because if you go directly home, unless you can go directly to outpatient, you're not going to get that kind of therapy 5 to 6 days a week versus 3 days a week from home health, I mean, there's a time and a place for that, but directly after surgery, I think, of course, I'm a big rehab person, so right. I believe that that's the best way to go. And so
outside, you're saying, so someone goes home, but someone drives them to Regents Park.
Right.
They have their therapy, then they go home. Then they come back the next or second day or third day, whatever it is, right?
Right.
And so is it typical that someone gets the therapy every day? Is that their body can handle that if they're a typical, knee surgery, back?
They get it 5 to 6 days a week, again, depending on the patient. Most orthopedic patients, I think, get it 6 days a week. But again, if you're elderly and you've got you had a fracture, fall fracture, surgery, you may not tolerate it 6 days a week. You might need that, day of rest in between. So it really depends. That's the therapist's call. It's really the therapist that determines how much and how long the patient gets the therapy.
So the ideal situation for Regents Park, of course, is to have somebody who's had some sort of repair, let's just say, right? And then there's a middle place, too. Like you said, maybe pneumonia.
Right.
Or some other things. When Bill came from the hospital, he had been in Bethesda, and then he went from Bethesda to your facility. But your doctor felt that he wasn't quite ready. He needed to really have more hospitalization.
Right.
And that was very smart of her. See, that was the fact that you had someone there who really looked at everything.
Right.
And then sent him back to Boca Regional, where they really got him in much better condition, and then took him. So that's all part of those things one doesn't see. They're behind the curtain, in a sense.
Behind the scenes, yeah. I mean, the doctor is important, the nurse practitioners. You have the coverage every day with, and I know that you had a great nurse practitioner as well. Yeah. It makes all the difference in the world. And, as somebody trying to advocate for the patients and the families, I can go to the nurse practitioner or the doctor and say, I want you to go see so-and-so. That might not have been their plan, but, they need to see you. Mm-hmm. And they're good about that.
Yeah, it's. I think you do have a well-oiled, pardon the expression, oiled facility.
Yeah.
Especially because you, even though you're on the outside trying to find other people to know about Regents Park, your heart is really in the Regents Park, and you pretty much know what's going on. Something we ought to talk about that you told me, that once a week or you review a lot of cases.
All the patients that are there for short-term rehab, or even the long-term residents that are receiving therapy for whatever reason, we review them once a week. See how they're doing, what's the progress they're making. Are there medical issues going on that is limiting their physical progress, which, again, with your patients with pneumonias or strokes, you're going to have those, weeks that maybe they don't progress that much. But then, we're looking at the medical issues as well. So, that's an intense little meeting.
Yeah, I'm sure it is. It's an important meeting.
It's a very important meeting.
Everybody knows, they're all together. I think hospice does that also. They have meetings like that. I wanted to ask you about that. You don't have hospice there, do you?
Yeah, we do.
I did not know that.
We're contracted with the 3 local hospices. They can, say there's a patient that's just not doing well. They can call in hospice. They can stay in the facility and receive hospice services. They can go to the hospice unit.
I think hospice there at Regents Park would be a much better way.
A lot of times the families will go with that because the patient's comfortable there.
And they know it.
Yeah.
Well, Leslie, I didn't know how we were going to get through this because it's the first time you and I discussed Bill and, of course, that he passed and what happened. But I was glad to do it with you. I was looking forward to it, actually. So please do call them at 561-483-9282 if you have any questions. Thanks, Leslie, for everything you did for Bill and for me.
Thank you.